Sciatica is a very common type of back-related problem. The actual irritation of the nerve starts here in the spine. You see these nerves which come out from this area, L3, L4, 5, and so they go down and they come out of the spine, the sacrum area, and then it goes here, it comes out and it goes along the leg like that. Okay, so the pain actually is felt on the outer side of the thigh, the legs, and right down to the little toes. So this sciatica is a very painful thing. No matter what you do, and in certain positions the electric current goes down and you get spasm. Whether you lie down, you sit down, you walk, or even when you sleep, you may get continuous pain. Often there's no relief. So people have all sorts of treatments and manipulations trying to get rid of it. I've studied sciatica for a long time, and I've got various ideas about it. So basically, there are a few types of sciatic pain that goes down the leg. The first type is when the discs from here, they scratch the nerves or the nerve roots. So it's connected to the disc. There's a disc bulge of some kind in one of these areas, and it scratches the nerves and the pain goes down like that. So that is the first type. The second type is caused by muscular spasms. When you sit a long time and you get spasm in the gluteal muscles, so this is where the nerve comes out. So the spasm causes tightness of the muscles and it presses on the nerve and you feel the sensation going down. The third type is connected to the hip joint. It's almost in 30-40% of the cases, it's all due to the hip joint. So when you walk with one foot, you look at your feet and you'll understand when you stand that if one of the foot is slightly moved to one direction, then the hip joint is also displaced. The hip joint is sort of a ball and socket joint, and if slightly displaced, muscles go into a spasm and you get one type of pain. The third type is in the pubic region when you carry things, you lift things, and you get irritation in the groin area, or you've done too much of lifting, weightlifting, sports injuries, you get that, and the body, in order to protect itself, it twists the hip. So when it twists the hip, you get very sort of spasms, and that spasm causes the pain there. And there's another type which is caused by stenosis. There's the central canal where the spinal cord is located, and these discs, when they bulge inside, not laterally, when they bulge inside, they narrow the canal. Central narrowing of the canal takes place, and as a result of that, some nerve roots are irritated, and you get the pain along this. Now, I'm going to discuss the treatment of the common one, the most common, which is the disc-related ones. So, as I just said, that is these nerve roots which are irritated by the discs, or movement of the facet joints, with muscular spasms and all that, and you get irritation of the nerves because of some pressure on the disc, So basically, you can cause the disc compression of vertically, when you press on the one against the other, then you get a bulge. That's one type. Another type of bulge, which is about, again, in 40-50% of the cases, the bulge is lateral. So if you take two blocks of wood and put a hot water bottle in the center and twist the blocks in opposite direction, you get a bulge. Now that is due to lateral torsion. The disc bulge takes place because of lateral movement like that, okay, which is again related to the facet joint. So when that happens, then the discs bulge, and so this is the area where the discs bulge. So you start off with the massage of the deep into the muscles, going down to the sacrum area. So you massage the whole of the spine, right? The first type is the disc type of sciatica. All these discs, intervertebral discs, they bulge due to torsion when the spine twists one against the other, or they bulge due to the compression. Then they start scratching these nerves and the pain goes down to the sciatic area. Okay, so obviously we start off our main focus will be here in the lower back area, L3, L4, L5, then the gluteal region. So that will be the main function. We start off the treatment by toning up the muscles of the entire spine. We do the neck first, staying behind the ears and in this rotative action, and then you do the trapezius on both sides though. Then you tone up the upper back muscles, right down to these tendons of the erector spinae muscles, the long muscles that keep the spine straight. So you do that on the other side as well. Right. Now, as I said, we have to focus on this area. This is where the problem is. Now, in sciatica, this area is going to be really, really very sore. So you go on each side of they move away from the central part of the spine by an inch or so, and you massage by rotation like that, applying pressure down into the vertebrae, right? 1, 2, 3, 4, up. 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 Up. After you've done about 6, 7, 8 times, then you increase the pressure on that. The same thing, but you increase the pressure like that. 1, 2, 3, 4, up. 1, 2, 3, 4, up. 1, 2, 3, 4. This, because the sciatic is on this side, so you focus on one side only when you come to here, all right? So you press down and leave it. Press down and leave it. So release the pressure. So you'll be treating the muscles and applying pressure on the vertebrae as well, moving it slowly. See, in case of the disc bulge, the disc touches the nerve, scratches the nerve a little bit. All you have to do is to move the spine in such a way that it moves, the bulge moves away from the nerve by just a milliliter. So it touches like that and it just moves and you get relief in sciatica. It's a magical thing. Just the slightest of movement will cause you relief. And then over a period of time, you do the exercises, you have some general massages, and things will sort out. It'll stay like that, you know. So you have to change that, make that postural changes through these physical treatment. Do the sides a little bit, because this, very often in sciatica, one side of the back moves to one side because of the spasm. So place your hands on the side and you come inwards towards the bulk of the muscles, Press that from that side as well. Start below the rib cage. Pull it inwards, or if you're doing it from this side, push it inside. So you do these things. Then you move to the gluteal region, which is very, very important for sciatica, this part. So this is the, you can say the hip bone. Just go below that. And whole of the gluteal muscles, including the ones which are here. So you massage the gluteal muscles, releasing all the spasm. It will cause the patient a little bit of pain, but no pain, no gain, they say. And it's absolutely safe to do that. Press, massage. So the whole thing, the treatment of this should be for about 10 minutes, and you spend 4-5 minutes on the gluteal region, releasing the spasm very deep, because it's pressing the nerve, and you have to give it some rest by releasing the pressure on the nerves from these gluteal muscles. When you've done that, then you do the hamstrings a little bit here, massaging the hamstrings like this, massaging the hamstrings like this, right down. And the popliteal region just behind the knees, that area also needs to be done a little bit, so that you get rid of the spasm on the whole of this side. Okay. If you're using the massager, then you can use this attachment or a spherical attachment. You do the neck as usual, the trapezius muscles too, and then you go down the whole of the spine, both sides, right down here, do that. And then when you come to the lumbar region, you press hard, 1, 2, 3, 4, lift, 1, 2, 3, 4, lift, 1, 2, 3, 4, lift, 1, 2, 3, 4, lift. Then the tendon here of the rectus spina muscles. So do that again. Just apply a little bit of pressure. It'll be painful. Sometimes you can get the sciatic pain going down while you do it. It indicates that the problem is here. You do that, all these areas. Then you do the gluteal region, right? Whole of the gluteal region. Although it's a big muscle here. So you do all of that, especially here, where the nerve comes out, just above that. Massage is deep. Then the hamstring area. All this should take at least 10 minutes. And as I was saying earlier, in one of my YouTube videos, that you should, when you get this acute pain, you've got a lot of pain, you try and do this treatment 3 times a day. Because usually what happens is when you go to a physiotherapist, you just have one session and then give it a gap for a next day or 2 days later, again you come. No. When you have this acute pain, and this is safe to do that, there's no manipulation involved, there's no drastic methods involved, no injection involved. You just do this 3 times a day. What you can do is you can also apply a little bit of poultice here. So on a frying pan, you heat up the salt, a cup of salt, when it's very hot, take a piece of cloth, right, handkerchief or something, pour the hot salt, don't make it too hot, pour the hot salt in the center and tie it up to make a poultice, a ball, okay, of hot salt, and touch it to make sure that it's not too hot. So that hot poultice, put a layer of towel if you want, and you apply here 1, 2, 3, 4, 5, the poultice, hot salt, 1, 2, 3, 4, 5, move it, 1, 2, 3, 4, 5, move it. Do this thing till the salt cools down a little bit. You can also do it in this area, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, so that you don't continuously press, that will cause a burn. So you do that heating as well, and then we have to, with the sciatica, as I said, that all sorts of backache, you have to do the other side as well. So turn around, please. On the other side, you start from below the rib cage and you massage the straight muscles of the abdomen, rectus abdominis, and you go down to the pubic area. This area may hurt a little bit, so you massage the pubic area, massage all along on the side that you have the sciatica in, and massage the top of the thigh like that. It's important. Massage the top of the thigh and the oblique muscles on the sides. Just release the pain from all this. Usually it goes into a pain, it has a lot of pain, and the hip twists a little bit, so this will help with that. When you use the massager machine, then you do that right down from the rib cage. Because it's sciatica, you do it on only one side, and the top of the thigh as well, which is very important. Pubic bone is very important. Do this area laterally as well. You do that, and this should be for about 5 minutes in all. Now we'll do the exercises. Now we're going to talk about the exercises. Okay, the first one is when you keep your heels hip distance apart, bend your knees, take a deep breath in and up. We also do the neck, your head down, and just try and put this down like that. Hold it. 1, 2, 3, 4, 5. Down. Up again. 1, 2, 3, 4, 5. So this you should do for about 5 times. And remember, if you have very acute sciatica, then you need to do this 3 times a day, and the massage and probably the poultice with hot salt 3 times a day. So we do this 5 times. The next one is to hold your knees, try and touch your chin, hold it 1, 2, 3, 4, 5 and let it go. Yeah, this one, breathe in, breathe out, 1, 2, 3, 4, 5, let it go. Again, this one, breathe out, 2, 3, 4, 5. Okay, then having done this, the third one, okay, I mean, you have to drop your knees on one side, right? Stretching the hip like that and taking your chin right down. Hold it, 1, 2, 3, and the other side, right? 1, 2, 3, and the other side, right? 1, 2, 3, and this side. 1, 2, 3. So you do 5 in each direction. It's very important to do that. Now turn around, please. Okay. You put the hands underneath the thighs. Take a deep breath in. Head up, look up, feet up, the torso up. 1, 2, 3, 4, 5. Down. Up again. 1, 2, 3, 4, 5. So you do 5 of these. 3 times a day. Hands behind your back. Up again. 1, 2, 3, 4, 5. Down. Up again. 1, 2, 3, 4, 5. Okay. Now, put your elbows by your side, right? Don't lift your elbows. Just take a deep breath in and look up as far back as you can without lifting the elbows. 1, 2, 3, 4, 5. Down again. Breathe in. 1, 2, 3, 4, 5. So you do 5 of these. Then what you do is you contract the gluteal muscles, let go. Contract, let go. Contract, let go. So do this for about 10 times. Good. As I said, you see the compression of the disc can be vertical, the vertebrae are here, so there's compression of the disc vertically, or when there is a torsion, when there is facet joint movement and due to some type of work, sports injuries, like squash and all these things, then when the vertebrae moves, then there's a disc bulge. Okay, so there's disc bulge due to compression of the spine, disc bulge due to torsion of the spine, the 2 types. So these exercises that I gave you will cover most of the things like that. So be persistent, don't be afraid. It may take a few extra days, but do the treatment 3 times a day. That's what is important. When you do it at home, you have got the opportunity for somebody to help you and you'll be all right.